Right, I do want to let everyone know that our call today is going to be recorded. You should have a memo on your screen asking you to accept. I'm going to. Okay, there we go. Right, so before we begin, I do have a couple of items for our webinar protocol just to make sure that everything is running smoothly and so that we can hear everyone. We're just going to ask that you please keep your phones on mute. We do kind of like to keep things kind of casual here so that everyone's comfortable with engaging. So throughout the presentation or any information that Jessica and Marita are presenting, we want to open up the floor for you to engage, provide feedback, anything that you found beneficial, any challenges you've had. This is really an engagement segment so that we can make sure that we're getting the information that is needed to make sure that the standards and measures proposed revisions are best fit for tribal public health systems. So any engagement you can offer is very much appreciated. You can also use your chat box or unmute your phone lines if you have any questions throughout the segment. And of course, we'll have a portion at the end so that you can ask your questions as well. So I do want to introduce myself. My name is Jessica Dean. I'm a public health project coordinator with the National Indian Health Board. I primarily work with the Strong Systems, Stronger Communities grant opportunity, which supports capacity building for tribal public health systems. And we also help with any activities around the public health accreditation. And I also assist with the fixed capacity scan as well. Today we'll be hosting the Public Health Accreditation Board. So I do want to open the floor and allow Jessica and Marita to introduce themselves as well.
Great, thank you, Jessica. I'm Jess Kronstadt. I'm the Vice President for Program Research and Evaluation at the Public Health Accreditation Board. It is great to see you all. Some of you have been part of this journey for a long time, so it's good to see you again. For some of you, it's our first chance, so we're happy to engage with you during this discussion. As Jessica said, this is going to be casual, so feel free to jump in with questions in the chat or just shout them out or wave your hands and hopefully we'll see you. But if we don't see you, we're not ignoring you purposely. Shout it out, get our attention. We really do want to hear from you. So I do want to introduce my colleague, Marita Chilton. She's the Director of Accreditation. And what we're going to do today is we're really going to sort of talk through the process of how we got to where we are today, which is we have a draft of the standards and measures. We're putting them out for public vetting. As I've said, some of you have already provided input as we've gotten to this point, and so we'll sort of talk about some of that input. We'll give some high-level overview of what some of the major changes are, and in particular, some of the ways that we've really taken your feedback and incorporated those into the standards and measures. And then we'll talk about the vetting process. So we welcome any questions, any high-level feedback now. If you have specific feedback at the end, we'd love to hear that too, but we'll also describe how you can go through the vetting process to get into sort of the nitty-gritty of, what did you do to measure 1.3.2 and that type of thing. So that's our plan for today. I'm going to turn it over to Marita, who's going to get us started by talking about version 2022 and how we got here.
Thanks, Jess. And I'm just sharing my screen now. Can you see the slides? Great. All right. So as Jess said, we're so excited to reach this public vetting stage of creating version 2022 of the TPHAAB standards and measures. We're really looking forward to hearing more feedback from the field and using that feedback to further revise and refine the standards and measures. It does mean that the requirements are going to continue to evolve. So we're going to provide some examples today based on the current drafts that are out for public vetting, but we do want to note that these are, there are likely going to be changes when we release the final version in early 2022 because of what we learn in the coming weeks. So in recognition of the changing nature of public health practice, TPHAAB embarked on a multi-year journey towards the development of version 2022 standards and measures, which started back in 2017. Both the initial standards and measures and reaccreditation versions were informed by recommendations from a number of different inputs. We went through psychometrics, we looked at the available evidence, we've done content analyses, we commissioned papers, held expert panels and think tanks, and those mainly convened between 2018 and 2020. And then over the last 9 months, FAB staff have been working to develop the drafts, which were further reviewed and refined by our Accreditation Improvement Committee. As Jess said, we had lots of discussions. Some of you all participated in those as we were going through this process over the last 9 months. And then on September 10th, the FAB Board of Directors approved the drafts for public vetting, and the vetting period opened on September 14th. Vetting is going to be open through November 5th. And then, as I said, we'll use the input collected during this time to develop the final version 2022, which is going to be released early next year. A little bit more about that timeline for rollout. So for health departments planning to apply for initial accreditation, so if you're going through for the first time, version 2022 will go into effect on or after July 1st, 2022. And we'll give an exact date later this year. So for any health department wanting to use version 1.5 or the current version of initial standards and measures, they can submit their application to FAB prior to that changeover date and use version 1.5. Health departments that are planning to apply for reaccreditation during the 2022 calendar year have the option to either use the current version or to use version 2022. So for those reaccreditation health departments that want to use version 2022 and need a little bit of additional time to prepare, they can apply for an extension. And we're going to hold a webinar in early 2022 for any health departments applying for reaccreditation next year to provide some additional details. So the reason why the changeover date is different for initial and reaccreditation is because initial health departments can kind of use that cutover date to make their decision about which version to use. Reaccreditation is on a pre-established schedule. So this option provides health departments that are going through the reaccreditation process kind of the same flexibility that's inherent in the initial process. Health departments that are either scheduled for reaccreditation in 2022 or health departments that are just interested in applying for initial accreditation are encouraged to review the draft standards and measures that are currently out for public vetting so that they could get a better sense about the proposed changes and make an informed decision about which version to apply under. So when we embarked on the development of version 2022, 4 primary goals were established to help guide our effort. These were approved and signed off by our board in our December 2020 meeting. And I do want to really note that each of these goals were based on recommendations from the field, especially one that we kept hearing that input collected from health departments pursuing accreditation, site visitors, and others really be used in this revision. In the next couple of slides, I'll kind of highlight reflections about each of these goals. So one of the goals is to reflect the current aspirations of the field, as I just mentioned. So on the timeline that you looked at a minute ago, you saw that we've been gathering data for version 2022 over the past several years. The word cloud here on this screen includes many of the topics from think tanks and commission papers, and summaries of each of these think tanks are available on the version 2022 page of FAB's website. We also used findings from surveys and other field input, such as all of the site visit reports, our evaluation data, all the questions received by accreditation specialists from health departments and site visitors. We also conducted a survey with all health departments and site visitors during COVID-19. Goal number 2 was to focus on the intent of the measure and to try to reduce the documentation burden by streamlining the requirements. So FAB staff identified that in version 1.5, there are multiple places where health departments provide the same or very similar documents across different measures. So we were seeking to reduce that duplication. So for example, by moving all of the requirements related to surveillance into one standard, there are no longer similar requirements spread throughout multiple domains. These images show the number of measures, required documentation sections, and documents in version 1.5 and the version 2022 draft. Initial accreditation is the image on the left and reaccreditation is on the right. So for initial, the main difference is that the number of documents required decreased by over 120, from 329 down to 207. And some of this decrease does account because we've shifted a few items over to the application, but version 2022 significantly reduced redundancy to eliminate uploading the same or similar documents multiple times. For reaccreditation, the total number of documents required is relatively consistent. Although when you look at it, the reaccreditation version does appear longer in length, and that's because we added in additional requirements and we split up some measures so that there's less RDs in each measure, which was based on feedback that we'd heard from the field. But the number of documents required is about the same. To help promote accountability as part of goal number 3, we've specifically called out the foundational capability measures within the standards and measures. So if you're not familiar with the foundational public health services framework, it's the suite of skills, programs, and activities that must be available in all health departments everywhere for health systems to work anywhere. It was derived from the 2012 IOM report on public health financing, and it's housed at TPHAAB's Innovation Center, the Public Health National Center for Innovations. The capabilities or the infrastructure listed in the blue box are those cross-cutting skills and capacities needed to support basic public health protections and other programs and activities that are key to ensuring the community's health and achieving equitable health outcomes. And then the programs, or those foundational areas across the bottom, are those basic public health topic-specific programs that are aimed at improving the health of the community. Not listed in the diagram, but it is part of the framework, are also those local protections and services that are unique to a community's needs. There are nearly a dozen state systems, kind of state, local, and tribal health departments working towards the foundational public health services implementation. The foundational capabilities are contained in the existing TPHAAB standards and measures, so they are in the current version, but we're making a more clear articulation of them by designating some measures as foundational capability in version 2022. We did a crosswalk and identified measures that correspond to the details within the current descriptions of each foundational capability. So this screenshot is just a small excerpt of that crosswalk. In the version 2022 drafts, if you look at them for vetting, you'll notice that specific measures are identified as foundational capability measures. And our fourth goal was really to clarify requirements. We did this by having a very careful review of the types of questions that we currently receive from health departments and site visitors, and we've sought to preemptively avoid some of that confusion. So we moved all of the required elements into the required documentation column, or that column there on the left. In the past, health departments would need to carefully read the guidance column to identify all the elements that must be included. So we've moved them all over to the required documentation column, and then we've also separated out bullets. So in this example, you can see A, B, and C to separate out each required element. This formatting change was really intended to help improve readability. Another thing that we did in the guidance, we're trying to use more plain language and add in a lot more examples. This example shows that in addition to the kind of general guidance circled in blue at the top there, that we also have guidance about each of those bullets to help clarify what each required element is looking for. And then one additional change that I'll point out is that the purpose and significance have been moved into one box below the name of the measure. And this change was also intended to help improve readability. Couple of those high level things that we did across the version 2022 drafts that I want to point out. So in September 2020, TPHAAB adopted a new strategic plan, which includes a priority to create and implement a comprehensive anti-racism, diversity, equity, inclusion, or DEI strategy to address structural racism and inequity within TPHAAB, public health departments, and the public health sector. FAAB also commissioned a paper advancing health equity in health department's public health practice and convened a dedicated health equity work group to inform version 2022. So version 2022 does have a much greater emphasis on equity, which is consistent with the revised 10 essential public health services framework also. So that link at the bottom of the screen, which I'm sure we can put into the chat, takes you to a document that highlights those measures in the draft version that include a requirement related to health equity concepts. So this one pager doesn't cover every equity measure that includes equity related work in the guidance or the examples, but it does provide examples from every domain where it's in the requirements. And we were really intentional during the drafting process to infuse equity throughout all of the domains in the standards and measures. Want to just show a few examples of where equity is present in version 2022. So if you look at domain 2, you'll see it as part of ensuring attention to social determinants of health and inequities as part of containment strategies. In domain 4, you'll see a requirement around engaging in cross-sector collaboration to advance equity. In domain 8, we include an equity assessment in the workforce development planning. Then in domain 10, a requirement around having internal policies or initiatives focused on inclusion, equity, or anti-racism. And then equity, of course, is also a focus of the requirements related to the community health assessment and the community health improvement plan. One other thing that I want to note before I turn it over to Jess is that all of our preparedness standards or all of our preparedness requirements have been consolidated into standard 2.2. So previously you saw them spread across several different domains, and we put them all into standard 2.2 in the version 2022 draft. And this is probably where you're going to find the most significant differences if you were comparing the current version of the standards and measures to the draft. We made significant changes in the standard about preparedness to address the lessons learned during the COVID-19 pandemic response, and also to improve alignment. The EOP in particular is the one core plan for which we're proposing substantial revisions. And while the draft requirements are new to FAAB, we actually think that they'll be very familiar to health departments because they are much more similar to the functions that are described in the ESF 8, and they're very carefully aligned with NECHA's Project Public Health Ready and CDC's Operational Readiness Review for Public Health Emergency Preparedness, or the FEP grantees. Within Standard 2.2, we also include some requirements around administrative preparedness and testing, improving preparedness and response functions. The good news is that this alignment should help reduce some additional barriers for health departments. Already, CDC has agreed to exempt accredited health departments from the review of Capability 13 related to surveillance as part of those Operational Readiness Review reporting requirements. And FAAB plans to exempt PPHR, that Project Public Health Ready recognized or re-recognized health departments from providing documentation for Standard 2.2. So if you're PPHR recognized, you won't have to submit anything for Standard 2.2 under version 2022, other than evidence that you've been recognized within the past 5 years. And then NECHA is also planning to exempt accredited health departments from providing PPHR documentation related to surveillance. So that's in their Measure 1 criteria M. If you're FAAB accredited, you wouldn't need to submit evidence for that piece. So with that, I'm going to turn it over to Jess, who can dive in a little bit more about what we've done.
Great, thank you. So as I mentioned before, we've been really fortunate to engage with many of you throughout this process. And so I just wanted to share with you some of the ways we've gathered feedback and some specific examples of how we've integrated that feedback into the drafts that are available now for vetting. So we have, I know there's a lot on the screen. We don't expect you to actually read the text, but these are just sort of visual cues to remind us of the ways that we've gathered that feedback. So the first piece is actually something that we developed in working with you all several years ago, which was the supplemental documentation guidance for tribal public health departments. And that was meant to be a companion document to go along with version 1.5, the current version of the standards and measures, which had specific, guidance about how things might apply in Indian country. And what we've done this time is we've taken the guidance that was in the supplemental guidance document and tried to integrate it directly into the standards and measures, with the hope that we won't need, the standards and measures and a companion document, but that it will all be in one place. So I'm just going to give you a very specific example if you wanted to kind of see what we mean. If you look at the supplemental guidance for measure 2.1.2, it talks about how tribal health departments can use agreements with IHS or other organizations to show how they conduct investigations. So instead of having that in a separate document, if you look in the guidance column for the analogous measure, which is now 2.1.4, you'll see very similar text right in there in the guidance. So again, we'll see, we'll see if, and we'd love feedback from you all if you're reviewing this to make sure we've incorporated all the guidance we need to directly within the standards and measures document. We also received a very helpful memo from TPHAAB and NIHB about some suggestions related to version 2022. They really asked us to limit, additional documentation requirements and try to be very mindful about not raising the burden too hard and too high. And I think, as you saw from the slide that Marita showed, that's really been something that we've been working very hard to do, is to keep these standards and measures manageable, to reduce burden wherever possible. We fully expect during the vetting to hear from you all and from the rest of the public health field about how well we did in meeting that goal. But that really was something that we worked on doing. There was a recommendation that we acknowledge tribal data sovereignty, and we'll talk a little bit more about a couple of places where we've done that in particular, as well as some clarification of language and concepts. So one very specific tangible example is that FAB had used the word consultation in a pretty vague, generic way, which also meant, providing support or guidance or technical assistance. And recognizing that consultation has a more specific meaning in tribal communities, that it's about that formal government to government, process for decision making. We've been very careful not to use consultation unless we mean it in that particular context, just to avoid some confusion. There are also recommendations about the relationship between the support that was provided by state health departments to tribal and local health departments, and we'll show you some examples in a minute of how we've really restructured those requirements. We also had a series of work group meetings last October through December, which some of you participated in, to really get some feedback on a number of different topics. We shared the findings from across the think tanks that we'd had on various topic areas and got insights from you all and the other participants about topics like quality improvement, behavioral health, environmental health, et cetera. And so we really tried to incorporate those findings, those recommendations that we heard from you all at that point in time. And then finally, one thing that we did this year, which we haven't done in the past, but I'm so glad that we did, is before we released the version for public vetting, we shared selected measures with our partner organizations, just gave them a sneak peek of a few measures, and were able to take their feedback before it went to vetting. And we received really, really helpful feedback from Jessica and her NIHB colleagues. And so hopefully we're able to catch a few things, clarify a few things before the version that you see before us. So we know it's still a work in progress, but being able to have all of that guidance from you all over the past several months has really helped us shape the standards and measures to where we are now. Next slide. So I want to talk a little bit, as I mentioned, I wanted to go into a little bit more detail about a couple of the recommendations. So one, we heard the comment about being respectful of tribal data sovereignty. And so we made a change, for example, in the measure that talks about how the community health assessment or tribal health assessment is shared. And so we've clarified that there isn't the same, expectation that it necessarily needs to be available to everyone in the community, but having making sure that the tribe makes the most appropriate decision about where to share those data. Similarly, in the measure about the website, when we talk about making public health data available, we have other language in there as well about having the tribal health departments choose the extent to which they want to make data available. We also wanted to recognize the important role that tribal epicenters play. So we reference them in several places in the standards and measures, including within the measure related to the community health assessment, and they can be partners in that. There's also a new requirement that talks about the role that health departments play in data sharing. So either being the providers of data or the recipients of data that's shared through a data use agreement, et cetera. And we specifically called out the fact that that could be done through an intermediary. So that's another role that the tribal epidemiology centers could play. Next slide. One of, I think, the changes that I'm really excited about, and this definitely came through in the conversations that we had, during the work group meetings last fall, and then in our subsequent follow-up conversations with NIHB, is really thinking through, there are several requirements that talk about the role of the state health department in providing support to tribal and local health departments. And we really shifted those around quite a bit. And so one of the things that we really tried to make more clear is that it's not sufficient to just, I think in the past it could be, the state provided technical assistance to a health department, whether it's what they wanted or not. And so we've really tried to reframe those requirements and make them much more about the state health departments being responsive to the needs of tribal and local health departments. So, whether it's through a more formal assessment or just asking the question about, what type of assistance would be more useful to you, and having it be, shaped by what are the needs, as opposed to just the state health department deciding that this is what they're going to do in their, for tribal or local health departments. We also infuse the concept that there could be mutual learning. So some of it could be, states learning from tribal and local health departments, or creating opportunities for health departments to learn from each other. So here are some specific examples of some of the measures where we put that in. We're going from left to right, we're going backwards. We're starting at domain 9 and working our way back, but we have, a measure about interpreting, adapting, and applying research and results and evidence-based learning. So again, really having the state health department has the first step is understand what the gaps and needs are, and then providing support that's responsive to those needs. Similar with the emergency preparedness, the strengthening the workforce, so in domain 8, as well as in developing emergency operations plans. One of the other things, and this is partially a lesson learned, unfortunately, and often painfully, I think, in the COVID pandemic, is to really focus on what type of communication there is during an emergency, to make sure that if there is an action that the state is taking that has implications for tribal or local health departments, that be really clearly communicated, and that there be a process so that everyone in the system is on the same page about those policy decisions that are going to have impacts on a local level. We also really wanted to make sure that during investigation, so this is in more of the surveillance measure, that there really is that clear communication, both in the cases when, if there's a tribal health department that is leading the investigation, what kind of support might the state offer to that tribal health department, and vice versa. If the state health department is taking the lead, there still needs to be coordination and communication with the tribal and local health department. So we spent a little bit of clarification on those measures. We've also added a new measure that really focuses on those statewide data sharing systems and data systems. So this would be if there is a registry that tribal or local health departments participate in, but are sort of housed at the state, that there really be support in making sure that those systems work for those health departments that are reporting into them, that they're getting their data back, that there are opportunities, to provide feedback, for example, in terms of what enhancements need to be made or what technical assistance is needed. So I think this is an area where we've hopefully made the requirements in such a way that they'll really help build and strengthen the relationships between, throughout the full public health system. Thanks. Next slide. One of the other changes, and this was a conversation that we've had with some of you over the years, is really thinking through what the relationship is between population health, healthcare, social services. And TPHAAB actually, even before introducing version 2022, which is still in draft form, we've actually revised our scope of authority policy to really broaden the types of examples that could be included. So for those of you who are, who have gone through accreditation process earlier, you may have run into cases where, there are programs that you do and it was deemed, well, this is a little too clinical or a little bit too social services focused. And I think we've really broaden those definitions. We're still interested in what the health department is doing to create systems of care to address populations. So we really don't want to get into the nitty-gritty of an intervention between one clinician and one individual. But we realize that there are larger systems that health departments often play a very vital role in. And so we want to make those available for documentation. So we have in our new scope of authority policy lots of examples of, if you're using data or quality improvement programs or setting up a mass vaccination event, all of those things would be in scope, even though we don't want to get into the details of how do you administer a single shot into one single arm, but clearly everything that goes into the communicating about it, the setting up the process for it, the improving the process is within scope. So that was part of the change. I think we also, just in recognition of the importance of serving that whole person orientation, we have a new standard that really looks at how the health department, in collaboration with other sectors, improves access to social services as well. So we had a similar measure related to healthcare, and now we're broadening that to social services. And we're also including the particular need to collaborate with those other sectors when there are service disruptions. So, making sure that individuals still have access to prescriptions or food or housing when there might be some disruptions that, either in the case of a pandemic or a natural emergency or something else unexpected happens, for example, if a local clinic closes and there needs to be some changing around to kind of figure out how care can be provided. We did also really want to bring into play the role of the community health representatives. And so we referenced them in several areas about the key role that those individuals can play in terms of a lot of different things. So both containing and mitigating, in the event of disease spread or things like that, but as well as, obtaining access to healthcare services, coordinating care, et cetera. So really across the spectrum, what role you might see a community health representative play. Next slide. And then the last thing that I want to do before I shift gears a little bit into talking more about vetting is just to give a quick either introduction to or update for those of you about our Performance Pathways Recognition Program. So this may be something some of you have heard us talk about for a while. It's actually been one of those things that we've heard from the field for many, many years, that there was an interest in something else for those health departments that are just not yet ready to apply for accreditation. And so we have been working on coming up with a proposal for what that program might look like. And as you see on this slide, here are some of our goals, that it would really be, work towards supporting performance improvement, strengthening public health infrastructure, helping to transform public health systems. We see it as a milestone. So for health departments that are not yet ready to apply for accreditation, this is a way that they can be recognized for the accomplishments that they've made thus far. And for those health departments who want to use it as a step towards future accreditation application, it can help facilitate readiness. So we've had a number of conversations over the past many months about what this might look like. We're getting to the stage where we're going to test out parts of this model. There is a link on this slide you can see to the Pathways page where you can find more information. The reason I'm raising it in this context is because we know it could be a stepping stone for accreditation, then we are planning on using the same measures. So it will be a subset of the measures. It won't be the full set of 70 or so measures from initial accreditation, but the measures we choose will be the same ones. So if a health department provides documentation, is reviewed, that documentation is reviewed, it meets those measures, assuming you're still within the time frame, that same documentation could be used for accreditation, and that you would have met those requirements. So even if you're not ready for accreditation as a whole, we still encourage you to look at these measures as they would be the same ones, or a subset of them would be the ones we would be using for pathways. So I'm about to shift gear to talk a little bit more about vetting. So I do want to just pause. As I said, you're free to ask questions at any point, but I did just want to take a brief pause here to see if there's any questions. Maria and I have thrown a ton of information out. So any questions or feedback, like we like the sound of it, or oh my goodness, what were you thinking? Any questions or feedback we would welcome at this time.
And Jess, we have had one question that came into the chat that I was hoping that you'd be able to help jog my memory with. For the think tanks and the expert panels, were tribal populations represented via a federally recognized tribal government?
Great question. So for some of them, they were. We actually, when we did a round of think tanks previously, we were very careful to have at least one tribal representative at every think tank. What we were advised based on conversations with you all and with some of the colleagues at CDC who work with tribal populations, that an alternate strategy would be, after having the think tanks, to convene meetings just among tribal representatives to go over those think tanks collectively and gather feedback. So we sort of did some of both. We had some tribal representatives at the original think tanks, and then had a dedicated several sessions just to talk amongst tribal representatives about the implications of those. Yes, Lisa.
So when you say tribal representatives, you're clear that those are coming from federally recognized tribal governments and not organizations that support tribal public health?
Correct. Yeah. So I mean, we've also had organizations that represent them, but yes, our goal is to hear directly from tribal governments whenever possible.
Thank you.
Thanks for the question, Lisa.
Yeah, this is Vicki. That was going to be my exact same question, Lisa, with a caveat. When you say tribal representatives, is it actual employees, workforce of tribal organizations, or someone that is representing a tribal organization and not necessarily a tribal member? Do you know that?
Yeah, so I think for the most part, our goal was to get individual tribal members. We've also, as I said, it's been helpful to get, we have engaged NIHB as well to kind of get, additional perspectives. But yes, our goal is to get tribal members, and we really want that for this next stage in the process. So it's a great transition as we're talking about vetting. That really is our goal, to hear from as many tribal members as possible. And so any recommendations that you have about how we can best spread the word, encourage tribal members to provide additional feedback, we would love to hear that. That's part of the reason we're also recording this. So if people miss this call, we can send them the recording and they can get the same, overview. But please let us know if you have suggestions for how to best do that outreach.
Thank you.
Jessica, so I'm sorry, I'm going to have to re-ask my question again after that. So the representation on the think tanks and the groups was from they were tribal citizens from a federally recognized tribal government.
In some cases, yes.
Because that the government part is who holds the ability to become accredited. So the actual representatives from the tribal government itself.
Yeah, so when we were able to, that was something that we tried to do, but you're right, Lisa, we did not have representatives from tribal governments at every discussion. And so we've been looking for any other opportunity to get that feedback wherever we can.
Well, thank you very much. And I think it's super important for us to keep Vicki raising our voices about this, because we definitely want to be represented by our tribal governments and not other organizations.
No, and we do very much appreciate that. And we are humbly asking for help to figure out how we can do that as well as we can. Well, thank you both for raising that. I'm going to move along, but again, feel free to jump out at any time to ask additional questions. So here are just a few other resources that we have available on our website. So we are going to post this video soon. We do have a couple of other videos that kind of give an overview of the goals of the program, as well as one that steps through each domain and talks about some of the major changes. We have a frequently asked questions document that talks about both the questions about version 2022 as a whole, as well as the vetting process. So, and we have been updating that as we get additional questions. So I encourage you to look at that. And then we do have, if you go to the next slide, we do also have some of the information from the think tanks and expert panels. So you can see for each of the panels that we convened, you can see a summary of that discussion. You can see some of the background information that we've made available. We have commissioned several papers, so those papers are posted on that website. We also did a little bit of a data investigation to see what we can learn from our own data about accredited health departments and try to get that information in here as well. And then one thing that we recently compiled is a document that goes through each of the different think tanks, and for each one has just a few bullet points of how we've taken recommendations and incorporated them into version 2022. So it's not meant to be a comprehensive list of every recommendation and where it falls in there, but really to give you a flavor of here are some of the highlights where we saw recommendations and we put them into the draft standards and measures. Next slide. So here is where the magic of this stage happens, which is the vetting site itself. And so if you, this is a screenshot of what the vetting page looks like. We are very eager to hear from you, and we are very eager to have you help us hear from other folks, since we really do want to hear directly from you all. We have, as Rita said earlier, vetting is open until November 5th. We made it as long as we possibly could and still fit with our schedule. And as you'll see here, and I'll talk a little bit more about in a moment, we have 3 different versions of the standards and measures available for you to review and then provide feedback on. So if we go to this next slide, the first step in the process is to review the standards and measures. So, I gave you a quick overview here, and Marita and I tried to give you a sense of the big picture changes, but we didn't think it would make sense for us to go through, 100 or so pages with you all here. So we would encourage you to review the measures. You can also skip to the ones that are of interest to you. That's fine. So the first thing to do is actually to choose which version. I showed you there are 3 different color-coded versions on the page. So one are the initial accreditation standards and measures. So those might be of particular interest if you are planning to apply for accreditation soon, or you've just gone through the accreditation process and you have feelings about which measures you liked or which measures you'd like to see improved. You can look at that version. For those of you who are already accredited, we do have the reaccreditation standards and measures. So if you want to look ahead to see what requirements you might face in the future, we have the reaccreditation one. And then the third one is the set of measures that are designated as foundational capabilities measures. So that's something that Marita pointed out earlier with the crosswalk about which measures align with the foundational capabilities part of the foundational public health services framework. These are measures that might be part of pathways. It's possible that not all of them are. It's possible that there's some measures that are foundational capabilities measures that may make it to pathways. And of course, it will depend on what we learn through this process. But this might be a really good place. So if, for example, you're sort of starting out as forming a tribal health department, these are really the measures that focus on those core capacities. There are measures in every domain. So it kind of gives you a flavor across the FAAB standards and measures. That it might be a good place to start out to get a more focused look. I will note that there's some overlap in the documents. So if you review the initial accreditation version, for example, there's no reason to look at the foundational capabilities version because all of those measures in the foundational capabilities ones are in the initial. So if you want the streamlined thing, you can go directly to the pathways version. But if you're going to start with initial accreditation, no need to also look at the pathways one. The other thing that I will say is that based on what we've heard from the field over the years, there's really a lot more alignment between initial accreditation and reaccreditation. So just to give you an example, measure 1.1.1, which is the state, tribal, or community health assessment, is the same in initial accreditation and in reaccreditation. What we've heard is, your CHA is your CHA. Doesn't matter if you've been accredited for 1 year or 5 years, it should be the same. So that is indicated in the reaccreditation version. It tells you this measure is identical to, measure 1.1.1. It also means if you're providing feedback, you don't need to provide feedback on both. You can just provide feedback one time. We will take that feedback. As I mentioned, we know that these are long documents. Feel free to skip around. If you want to look at workforce, go straight to domain 8. It's really up to you. But once you have had a chance to review the measures, we ask that you complete the survey to be able to get that feedback to us. We are looking for feedback on everything. So are we being clear in what we're requiring? Is it feasible for you to provide that documentation? How important is this to public health? We don't want to be requiring things that don't have a value in how health departments serve their communities. This is another snapshot of what the measures look like. And so we've just highlighted a couple pieces here to really point out that we're looking for feedback on the whole enchilada. So every part of the measure, both the measure language that's circled here in yellow at the top. We want to know about that required documentation. That's the square on the left, which has everything that the health department must do. We want the guidance, which is all of the advice and the examples and the suggestions about how a health department might meet the measure. So we really are looking for any insights that you have about ways we might want to improve any part of the measure. And here you can actually see a screenshot of what the survey looks like. So the first screen, which you don't see here, is just information about your organizational affiliation. And then after you fill that out, you can select which domain you want to start with. So you can just go, in order, or you could skip around. It's totally up to you. Once you get to a domain page, it's going to look like this. It's going to have a question for every single measure, but again, no reason to fill out ones that you don't have an interest in filling out. So it's up to you to choose. What you'll see here is that, so here's an example of the very first question, measure 1.1.1. It gives you the name of the measure, but as I said, we want your feedback on any part of the measure and its requirements. We have a quick closed response question here about whether you like the way we proposed the proposed revision, whether you think it still needs some minor or major changes, or if we should toss it all together. So that's just a quick way for you to give us a sense of what you think about what we are proposing. And then really importantly, we want your recommendations or feedback. So if you're saying that it needs revisions, please tell us what revisions you would like us to make so that we can take your suggestions in mind as we craft the next version. At the end of the page, after you've done as many of those as you want, you can skip to another domain, or you can say you're done for the day and exit to the end of the survey. When you get to the end of the survey, you're going to see a screen like this, which just asks for a couple of overarching questions to see how well you think that this reflects, what we've learned in the field over the past 8 or so years since the last version, and really the clarity of the measure. So Marita started by telling you what our goals are, and this is sort of a way to help us get a pulse for whether we've met those goals. There's also an open-ended question for any other feedback that you have about anything. So that can be, overarching comments about the formatting, the way we've broken down the different pieces, any type of feedback that you want to provide about the standards and measures. You will have this free text opportunity at the end. A few more tips for the process. So one, we know it's a long document. And as we said, we encourage you to review the standards and measures first before starting the survey. So we've created, and this is on our website, a page where a Word document that you can download and then fill in and take your notes as you go. So you can note down which measure you are looking at, whether you think it should be revised, and you can type your comments in there so that you can sort of collect this as a note-taking place before completing the survey. And part of the reason we are doing this is because we think that you may choose to get feedback as a group. And so having this form might make that easier for you. So if you have gone through accreditation and have an accreditation team, you might sit down and do this together. If you're working on measures related to the community health assessment or community engagement, you might want to bring in partners. Similarly, we have governance measures related to the relationship with your governing entity. You could have that conversation with them. So that is an option for you. And just on a technical note, if you don't fill out the survey in one sitting, we encourage you to just submit what you've done. And then when you come back the next day to start another survey. That's because it sort of depends on how your browser is set up, whether it will remember what you put in or not. So you might, if you leave it for a day and you come back, you might see your responses, you might not. In either case, don't panic. We get your partial responses, so it won't be lost from us, but we just think it might be easier to just submit it after you're done for the day, and then you don't have to worry about that. And then just a final note before we open it back up for questions and feedback is that we do want to, just as a very small token of our appreciation, we know that it takes time to review this. We really appreciate that. And out of that appreciation, we are going to be raffling off 2 complimentary registrations to upcoming conferences. So there's an all-in meeting later this fall and to next year's public health improvement training, both of which will be virtual. So we will, if you would like to enter those raffles, that's something you could do at the end of the survey. You will need to give us your name so we can contact you, but we'll keep that separate. So with that, I really want to open it up. I know we don't have a lot of time, but I want to open it up to any questions, feedback, or as we said earlier, any suggestions that you have about how we can further engage folks in this vetting process.
Jess and Marita, thank you so much. Very helpful, very informative. And as Nathan indicated in the chat, that both Nathan and I are very new to San Manuel. They did not have a public health department. We are the first ones to be hired to establish one. And Nathan came across this information, and both of us coming from healthcare systems, we were eager to learn that yes, there are venues available where we can pursue accreditation. So we're definitely going to review this document and work our way toward that initial accreditation. Having said that, one of the things that we've, as you can imagine, there's just 2 of us, and there are about 400 tribal citizens and tribal community members, about 6,000 employees. The tribe also has a casino that has about 1 million visitors a month. So it's a busy time for us trying to manage, reopening, putting systems in place to control the spread of COVID. That's been our primary focus, but we're always thinking, hey, what is the broader scope of public health and where else we need to work? And one of the things that we want to do is collaborate with other tribes around San Manuel and see who has departments in place, systems in place, so we can collaborate with them. So we're very glad that we've connected with you, but do you have other folks from the Southern California area, other tribes that are participating in this program, and or you're in contact with them and encouraging them perhaps?
Thank you. Well, that's exciting to hear where you are in this journey. So because TPHAAB maintains the confidentiality of health departments that are going through the process. So we can only tell you, and it's listed on our website, which health departments are actually accredited. I think that, NIHB might be able to connect you with other health departments that are interested in this, that are in the process, but we have a little bit constrained because of those confidentiality restrictions.
Hey, yeah, and I'm jumping in to support Jessica because she actually has to go present at another orientation for our conference next week. So hello to everyone here. I think I know about half the room, but my name is Nina Martin. I work very closely with Jessica on all of our accreditation infrastructure related pieces. So Nathan, actually, I'm going to pop my email in the chat, and please feel free to send me an email and we can see. I know we'll have to check, but through the main program that supports tribes who are interested in exploring accreditation is our Strong Systems, Stronger Communities program. We may have had some previous grantees who are in the Southern California area that we might be able to connect you with or share information, but we also definitely encourage folks to explore that opportunity and just any of the resources from tribes who have gone through the accreditation process, who are currently in the middle or exploring. There are a ton of resources on our website. So I'll put my email in. Please contact me or Jessica and we can get you connected with some of that.
Thank you.
Okay, this is April. I'd just like to say I read through this once so far. Hi, Rita. And I asked Rita a lot of questions for years. Like I felt guilty because I asked her so many questions. So I think, I mean, so far my first read, it kind of clarifies stuff I was asking about better. It's not, it just seems, even as I look at the book, my tattered book, you know, it's some of it just was clear as mud. So I think it's better for sure. And I do appreciate this stuff with 7 because it drove me insane with how many services we have and we can't talk about them in a way. So that's great. And also it seems I have to look at it again, but 8, 10, 11, and 12 are kind of collapsed into each other and moved around. And I really appreciate that because you know, 8, 11, and 10, they were long. They were, I don't know, they felt in a way kind of like I was doing busy work sometimes. So I'm looking forward to reading it again now that and 3 has changed a lot too. And I think I appreciate the changes on the programming stuff. So yeah, so far I like it, I think. And now I'll read it again. So thanks for all of your hard work.
No, April, thank you. And your questions and other health departments that ask similar questions is how we were able to get to this current draft. We track all of those. And so we went back through and it was so helpful to know what was confusing so that we knew where to address it in this one. And I love your feedback on this version. Also, super huge congratulations on your recent accreditation status.
Hard work. And I missed you. I miss you.
I know, me too.
Yeah.
I know we're running a little over time already. We have a few more minutes for us, but I don't want to hold anyone. So if you have any other questions, let us know. You can also feel free to email us if you have follow-up. And we really, really do hope that you will take the time to read the standards and measures and give us feedback and encourage others to do so as well.
Once again, thank you, everybody. We really appreciate it.
Thank you for joining.
Hi, I'm late coming in. This is Kim Freewolf. I'm from Port Gamble. We actually did the through National Indian Health Board about 1.5 years ago and have the old standards and measures along with the tribal one. But with the Pathways program, we're getting ready to start working with a new quality assurance person. Is there anything that you can send us that we can start looking through and possibly submitting an application to go in again this year?
Yeah.
Or not, I'm not sure, because we moved into a new facility also. So we're kind of going lots of different directions right now.
Yeah, thank you for the question. So the Pathways program is still under development. We can put the link to that page, but you can't, it's too soon to apply for that. But one of the things that we've done with the standards and measures, the Pathways will be a subset of the standards and measures. And we've actually created a version that you can look at of the draft of the measures, which may be included in Pathways. So it's still, we're still under development. We can't promise that those will be the measures, but if you want to sort of start looking at what the detailed requirements might look like, you can focus on that subset of the measures and kind of use that as a starting point and sort of read through those requirements, and that will sort of narrow your focus a little bit. And then the plan is we will finalize the version 2022 measures in early 2022, and then we'll roll out the Pathways program. Our hope is sometime in the summer of 2022, but that will continue to give you, a good version of a sense of what those requirements might look like.
Okay, that's good and helpful. I appreciate that.
Great.
So I'm sorry, I kind of got my time zones mixed up, but I do appreciate you taking my time, my question, and I will look these things up.
Great. Thank you, Kim. I think if there are no other questions, we'll just thank you all again for participating in today's session. And we look forward to hearing more from you as you have a chance to review the standards and measures. So thank you.
Put my tribal one.
Thank you all. Really appreciate everyone's comments, and please help us spread the word and get additional input into the measures.
I'm going to hang on for a quick second, Marita, just because it looks like Director Howard might be joining. So I'll just see if he is connecting, and if not, we'll make sure that we connect with y'all about the recordings and such.
Sounds good. Thanks.